afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health of the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media in attendance this afternoon. We thank you for joining us as well, and always invite your questions. Just click on the question icon here on Microsoft Teams. And when you do, if you could indicate your name, your media outlet, and who your question is for. And finally, a welcome this afternoon to those folks tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching this afternoon on the CTV London website. Lots of questions already in the queue, so let's begin with the opening statements today, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. I'd like to commend the Premier for committing his government to working on a solution to the need for paid sick days for essential workers. So we'll wait with great interest to learn more about what the program might entail and when it will be enacted. But for now, this is a definite positive step and something that, once in effect, will assist all municipalities in the battle of COVID. The need for paid sick leave is something that I, along with other big city mayors, have advocated in support of. It's also something I know Dr. Mackie, the Health Unit, and the Board of Health has long lobbied for. So again, I appreciate the commitment made today by the Premier, and I take great comfort in knowing that Labour Minister Monty McNaughton will be playing a significant role in the development of a new program such as this, and for Minister Jeff Urick for his advocacy and personal support. Beyond that, I'm encouraged by what appears to be a flattening of local case counts, yet clearly the numbers are still too high. And what we know from waves 1 and 2 is that it's a gradual process. So for now, I'm cautiously optimistic that we appear to be seeing real signs of progress. It's another example that all the sacrifices being made by so many people and in so many different ways are not in vain. We need to continue to work together in the days and the weeks ahead. And speaking of looking forward to better days, I'd like to highlight the launch of a new initiative from the London Community Recovery Network. It's a new sidewalk sale application process for businesses to prepare for reopening. The objective there is to streamline the application process dramatically to allow businesses to host sidewalk sales on city properties and make it easier for businesses to serve customers safely outside when stay-at-home orders are no longer in place. And businesses wishing to display and sell merchandise on city sidewalks or boulevards in front of their businesses can now access a three-step application on the city's website with no associated fees. You can find more information at london.ca/B2B. And again, you know, it's another example of the London Community Recovery Network, which is a recovery-based initiative from community members directing how we can deal with the issues of recovery in the post-pandemic world. And finally, while we're on this subject of our current world, you know, I've seen and I've heard too often many examples of members of the public and folks who are just tired, which we all are, and cranky, which sometimes we can be. But it's really starting to manifest itself in ways that are not particularly pleasant. You know, I'm really going to highly encourage people to just take their breath, be mindful of others, and just show mutual respect. You don't want somebody yelling at you, and if it's a clerk or a bus operator or anybody that's in the service business or in the health professional business, there's no need to yell. People are doing their very best, and I know they are, and you know they are, they truly are. And you know, we can't just always blame it on COVID, but we understand it's because of COVID. But I'm just going to say, please, for all of our sakes, London is better than that, and Londoners are much better than that. So try a little kindness. I think we'll go a long way as we deal in what I hope will be the waning weeks and months of this pandemic. So that's it for me, Dr. Mackie. I throw it back over to you now. Thanks.
Thank you very much, Mr. Mayor. As always, appreciate your wisdom from so many different perspectives. So I'm going to go straight to our numbers. We had just 100 cases yesterday, 102 increase because of some referred cases that came to the health unit from other health units. That's continuing on with the sort of plateauing that we're seeing, down a bit from last week, but it's certainly not at a place where we're comfortable with those numbers. The trajectory is starting to look better, but we absolutely still need to maintain public health precautions and respect the lockdown for the coming weeks if we want to see that progress continue and get life back to normal. On the vaccination front, we had our biggest week ever over the last 7 days. We vaccinated 18,370 people over the last 7 days through our mass immunization clinics at Agriplex, Mount Bridges, and at the North London Optimus Centre. That's the largest total ever because we did get those roughly 5,000 additional vaccines in the past that was announced to us on Friday, which we were able to immediately absorb and put into clinics. So huge thanks and credit to all of the staff working so hard in those 3 mass immunization clinics. We still don't have regular reporting on data from family doctor offices and pharmacies, but they are definitely contributing to vaccinating in the region, particularly now that age has been lowered down to 40 for AstraZeneca. We're seeing a lot of uptake there, and pharmacies mostly sold out for weeks ahead for their vaccine appointments. And again, thanks to, most importantly, everyone who has come out, gotten vaccinated. Your contribution is incredibly valuable. You're protecting yourself and the people around you, but also to everyone who has been so public about getting vaccinated. Those who have posted on social media or elsewhere or talked to their friends or family, we know that word of mouth is the most powerful advertising. And so as you share your excitement about your vaccine, you're really helping others to make a good decision, which really helps keep us all safe in the long run. So big thanks to everyone involved in getting shots and talking about it. Dan, I'm going to stop right there and look forward to questions.
Thank you, Dr. Mackie, and thank you, Mayor Holder. Well, let's get into the questions right away. The first question, Dr. Mackie, is for you. It comes to us from Steve Young with CTV London and News Talk 1290 CJBK. Dr. Mackie, what do you make of recoveries that today outpaced the number of new infections? Is this a sign that we are turning a corner? Today we have, as you mentioned, 100 new cases, but also 140 recoveries.
It sure is a sign that we're turning the corner, Steve. You know, we're not where we want to be, but we're going in the right direction. And so when recoveries outpace new infections, that means there are less active cases in the community, and that's what this game's all about.
Thank you very much. Let's go to the next question. That's a follow-up from Steve Young. Dr. Mackie, what's the new eligibility criteria, and why is eligibility not wider at this point? Does the pharmacy vaccine system take any of the burden off public health, or does it become more confusing for all of the parties involved? Any thoughts on inconsistencies in vaccine administration among pharmacies?
So the new eligibility criteria opens to a fairly large group when you look at the people who have the health conditions involved and their caregivers. Each person with one of those high-risk health conditions is allowed to have one caregiver vaccinated. We're confident that will fill up appointments until our next vaccination eligibility discussion with partners. We have those discussions every Tuesday evening. We adjust as we need to over the week, but we are working closely with Huron-Perth Public Health and Southwestern Public Health to make sure that everybody in this region is getting vaccines as appropriate, roughly around the same timeline. We do hope that we will be able to open up to the larger group of at-risk health conditions. So there are 3 categories of health conditions according to the provincial phase 2 plan. You've got highest risk, which we've been vaccinating for some time. You've got high risk, which we just started vaccinating, opening appointments to yesterday. And then the at-risk group is a much longer list, probably tens of thousands of people in this area that includes everything from diabetes to asthma and many conditions that are very prevalent widely in our communities. And so we, as you can imagine, need to have the ducks in a row to be able to open to such a large group. And we do hope and anticipate that we'll be able to do that at some point next week. There were a few sub-questions here, so let me see if I caught them all. Second, does the pharmacy system take any of the burden off public health, or does it become more confusing for all parties involved? And then the next question about inconsistency in vaccine administration among pharmacies. Can't comment too much about the pharmacy vaccine campaigns. I mean, one thing that it really does help simplify is, we're already running 2 different vaccines through our mass clinics, the Pfizer and Moderna, both of the mRNA vaccines. It is helpful to have the AstraZeneca run through a different channel so we don't run into problems with, not having enough of one vaccine, or people going someplace to expect one vaccine and end up receiving another, or the worst case scenario, longer term, where somebody might get a vaccine at one site that is actually a different vaccine that is carried at another site. So the fact that we can take AstraZeneca and hive it off for that group is really helpful for us. Certainly had lots of, comments on both sides, people who are very happy to have gotten their vaccine through pharmacies, but on the other hand, some that have found it difficult and frustrating to have to book through, multiple different pharmacies to try and find an appointment sooner. So you really want to hear from the public about their experience there. I'm very happy that my wife was able to get an appointment for this Sunday. She'll be getting the AstraZeneca vaccine. She is in the age category that is eligible for the AstraZeneca, and that's at a pharmacy in East London. So our family's very happy about that.
Thank you very much, Dr. Mackie. The next question is from Jane Sims at the London Free Press. Dr. Mackie, the Premier announced this morning that the government will be putting together a paid sick pay package soon for workers, but without any details at this time. How important is it to have that kind of protection for workers in Middlesex-London? And are we seeing examples where guaranteed paid sick pay might have stopped some of the community spread of the virus?
Yeah, we certainly have seen some of those examples. The people who, the Middlesex-London Health Unit has supported paid sick leave for some time now, recognizing that in some data sets, you see a large proportion of people that are carrying infections, having likely acquired them through essential work, at a grocery store or that sort of frontline service work. Often the highest risk environments there are the staff rooms. So, situations where people let their guard down and spend more time maybe eating together without masks on, that sort of thing has been a driver of spread in those settings. But certainly if paid sick leave were available, that would be another tool to really not just give the verbal message, but also the financial support for people to take time off when they're sick, so they're not affecting their colleagues. That's something that many authorities have called for some time, and it's just a great move by the government to add that to the toolbox.
Thank you, Dr. Mackie. A follow-up question from Jane Sims. Dr. Mackie, there was a report today about hospitals, including London, having to hopscotch ICU patients to critical care areas all over the province. The report said that critically ill COVID-19 patients from the GTA are being sent to places like here, and because they have taken up room in the local ICU, London patients are being sent to ICUs in other cities. I wanted to ask if that is correct, and if you know how many patients are involved.
Yeah, I appreciate the question, Jane. You probably want to come on Monday and speak with Dr. Duclos from the LHSC perspective. Certainly am aware that we are getting patients here and across Southwestern. The Ontario West region, which stretches all the way from Hamilton to Windsor and includes Middlesex and London, has been asked to take hundreds of patients over the next few weeks from GTA hospitals that have been overwhelmed. So that will be happening ongoing. It's the right thing to do from the perspective of making sure that the healthcare system is acting as a system and supporting people across the province, not just those that happen to live in the same area as a facility. Beyond that, I don't have a lot of detailed information.
Thank you very much, Dr. Mackie. And yes, Monday we will be joined by Dr. Adam Ducalo, the Chief Medical Officer from London Health Sciences Centre. Another follow-up question, I think this is the last one from Jane. Dr. Mackie, Western University has indicated it would be willing to set up a mobile vaccination clinic. Are you in conversations about making that happen? And are there other organizations or institutions wanting to do the same thing?
Yes, Jane, we've heard about a number of organizations, private and public, who are willing to host sites and or help provide those vaccination sites. This is really a longer term strategy that is available in some health units that are hotspots in order to serve the hotspot communities. Our community still has not been designated as a hotspot, so there aren't additional resources, support, and vaccine for that sort of site. The reality around moving vaccines quickly into communities is the mass clinic approach is by far the most efficient. We do run mobile sites. We're doing, one or two every day, more as we get into the smaller facilities that might have half a dozen people over the next few months. That is always has been part of the campaign, really to address the issues of vaccinating people who cannot leave their home or the place where they're receiving the vaccine. Long-term care retirement homes were the first, but there are lots of congregate living settings like that where people really have difficulty making it to a mass clinic. That's the primary value of those mobile clinics. When we get to the phase of broad public availability, if we still aren't seeing the uptake numbers that we want, then the outreach model, going to where people are, making it more convenient for them, is definitely part of the plan. But at this point, we're seeing excellent uptake through the mass sites, over 80% uptake in the population over 80 years of age, and approaching that in the 75 to 79 group. And then each group, is increasing every week as we get more and more people vaccinated. And so that means the mass clinic model is working. And to break up the vaccine and or staff to try and provide mobile clinics has real opportunity costs and is not the most efficient way to move vaccine.
Thank you very much. Let's move to our next question. Jennifer Beeman is next in line from the London Free Press. And the question, Dr. Mackie, is for you. Yesterday, additional health conditions were made eligible for mass vaccination appointments, and you've touched on that already. When does the health unit expect to add more of these chronic conditions to the eligibility list? Is it something that may happen weekly?
Yeah, we do expect to add more within the next week or so. It's not clear whether we will be able to move to all at-risk conditions as of sometime next week, or whether we'll have to do a subset. You can imagine it is a very large group of patients, and what we have had, what we don't want is people all becoming eligible at once and then, majority of them being frustrated that they can't find an appointment. So that's something we're looking at very closely, but we will expand that over the next week and if necessary, in the weeks after as well.
Jennifer would also like to know, and we've talked about this on the briefings before, Dr. Mackie, how many weeks is the 25% reduction in Pfizer vaccines slated for? Will we see increasing vaccine shipments through the month of May?
So the visibility that we have from the provincial forecasting is only for the next 3 weeks. So that's all we know at this point. The numbers are always tentative until the week of receiving vaccine, and they can go up or down. Lately, the projections have been on the safe side, so that we haven't seen the numbers go down just before the vaccine shipment arrives. In fact, as I mentioned this week, the numbers went up by about 5,000 vaccines on Friday for the delivery that was slated for the next week, for this week. So that's the horizon we're looking at. We've also been told that on that same horizon, that there will be increasing shipments of Pfizer vaccine available across the province. How that gets allocated out is still being assessed. And I know that the province is working on, a data-driven, evidence-based method for allocating any additional vaccines. But we hope that, the first week of May, we start to see those shipments really start to increase again.
And one last follow-up from Jen Beeman. Dr. Mackie, Ottawa announced 300,000 doses of the Johnson & Johnson vaccine will be arriving in Canada next week. If the health unit receives some of this vaccine, how will it be used and on what target groups?
Yeah, so the Johnson & Johnson vaccine is really beneficial because of that one dose aspect. It's a vaccine that was designed to not need that second booster dose that the other 3 vaccines that are currently approved do require. So for that reason, it becomes most useful for people where it's going to be very difficult or unlikely to find them or have them return for a second dose. So people in high risk living conditions like shelters or in correctional facilities where they're unlikely to be around or there's a good chance that it'll be difficult to find them for a second dose, that's where it makes most sense to deploy Johnson & Johnson. You can imagine that convenience would be attractive from a number of perspectives, but from a public health perspective, we want to make sure to get it to places where people really just aren't likely to be able to get that second dose.
Thank you very much. The next question, Mayor Holder and Dr. Mackie, is for both of you. From Steve Young, who is with CTV and CJBK. Given the COVID-19 cases confirmed among staff at London Transit, should frontline LTC employees be prioritized for vaccination? Who would like to go first on this one?
I'll go ahead.
Okay.
Steve, thanks for that. If I had my way, I'd have all London Transit Commission employees, and for that matter, all Londoners vaccinated. But here's the thing, in a world of finite supply, how difficult is it to pick one organization over another? And it's why the provincial health unit system, as utilized consistently across the province, seems to me, at least, to be the fairest way to distribute the vaccine. Over to you, Dr. Mackie.
Thank you, Mr. Mayor. I think we are very much aligned on this. Would love to have enough vaccine for everyone. The reality is we've had probably 200 different workplaces that have had cases of COVID across the time of this pandemic, and we would love to be able to vaccinate all of those workplaces. At this point, the vaccine campaign is focused on preventing as many deaths as possible, and so the sequence of vaccine administration is based not on risk of acquiring the virus, but on risk of death. And that's, again, the provincial sequencing that we support, with preventing death being the #1 goal of the pandemic.
The next question, gentlemen, comes to us from Andrew Graham at Global News Radio, AM 980 CFPL. Dr. Mackie, in a new campaign aimed at combating vaccine hesitancy, Labatt Breweries has expressed interest in working with public health to set up vaccination clinics at Labatt facilities. Is this something the MLHU is interested in? If there's enough vaccine supply, is it possible we could see a Labatt clinic in London?
Yes, similar question to the Western question. We realize that employers across the city and county would love to have vaccine clinics at their facilities. We'd love to be able to provide that. Right now, we're focused on the most efficient model, and that is the mass clinic model. We're also seeing excellent uptake through the mass clinic. So, the efficiency of the campaign is our #1 concern right now. We're not seeing an enormous amount of vaccine hesitancy in our community.
Thank you, Dr. Mackie. Mayor Holder?
Yes, thank you very much. And I really appreciate that question. I've been approached by a number of companies in our community offering similarly the services as extended by Labatt's. And look, we appreciate it. I think it's really terrific that they would want to host a site that would be centralized, available for others. It really comes down to vaccine quantities. My sense is the potential for anything like that to happen is probably more likely when we finally have sufficient vaccine to be able to accommodate all of Londoners, and then we may be in a circumstance if our current sites either A, can't hold it, or B, if it just has more effectiveness or efficacy to be able to use other sites, then possibly. But it really does come down to being at a stage when everyone who's eligible to get the vaccine is able to get the vaccine. And so it really comes back down to that whole issue. And I think Dr. Mackie has covered his point on this quite appropriately as well.
Thank you very much, Mayor Holder. Thank you, Dr. Mackie. Follow-up from Andrew Graham, and I do want to mention at this point, we are getting to the end of the questions, so if you are a member of the media in attendance and you've been waiting to put your question in, now would be the time, so fair warning. Andrew Graham, again, at Global News Radio. Dr. Mackie, what are the latest COVID-19 case numbers for Cargill employees? Do you know how many secondary cases have been linked to that outbreak?
We are at 116 cases in association with the Cargill outbreak. That's employee cases. We don't have a tally of the number of secondary cases, and that's again part of the limitations when we're having an average of over 100 cases per day. We're unfortunately not able to do as detailed of contact tracing as we normally would. So 116, that's the number I've got for you.
Thank you, Dr. Mackie. And our final question right now, pending any questions coming in at the last moment, is a follow-up from Andrew. Dr. Mackie, if the health unit opens up vaccines to the at-risk groups you mentioned, do we have a sense of what the age range might be?
Well, so this is what we've got to figure out over the next week. So we won't have vaccine or clinic availability for everyone in that large at-risk group. So do we divide it by the health conditions, or do we divide it by age, or some combination? So unfortunately, I don't have an answer for you on that, Andrew. We will provide that as soon as we can.
Thank you very much. And that does bring us to the end of the questions that we have for today. Dr. Mackie, Mayor Holder, thank you both for your time. Oh, and I spoke too soon. Just a question coming in at the last second. Matthew Trevithick at Global News Radio. Dr. Mackie, you noted at least 200 workplace outbreaks had been seen in London and Middlesex County during the pandemic. Is Cargill the largest of the outbreaks?
Yeah, Cargill would be the second largest. The largest was the LHSC outbreak that happened in sort of November, December of last year. And then after Cargill, you're probably talking about some of the larger Western outbreaks, which wouldn't be workplace outbreaks necessarily, but we had that party outbreak that had about 50 cases involved. And then the case count per workplace outbreak declined significantly after that.
Thank you very much, Dr. Mackie. And right under the wire there, Matthew. Well done. That does bring us to the end for today's virtual media briefing. Thank you so much for joining us. We will be back with our next virtual media briefing on Monday afternoon at 2 p.m. We'll be joined by Dr. Mackie, Mayor Holder, as well as Dr. Adam Ducalo from London Health Sciences Centre, and the Warden of Middlesex County, Kathy Burkhart-Jessen. Between now and then, have a great rest of your Thursday. Have a wonderful weekend. We'll see you on Monday, and so long for now.